Hi, I'm Darcy from the ASPCA Spay-neuter Alliance, and today we're going to talk about head control with our dogs. Head control is extremely important when you're doing any type of procedure or treatment. The handler always needs to make sure they're maintaining head control, even on the nicest of dogs. You never know when you might touch something on the dog that's painful, or when something might startle them, and they could always turn to snap. So starting with the least amount of restraint is going to be the best, and then you can always move up from there. So today we're going to talk about what we call the progressive head hold, and it has 3 levels of restraint. So I'm going to put on my mask, and we are going to get someone to help us come in and show these levels of restraint. Okay. Okay, so the first level of restraint that we're going to do would help if you stood up for us here, Sam, is going to be the least restrictive. And so this is going to be the best kind of hold if we're just doing an exam, non-painful, and you just want to make sure you have a little bit of control. And so you're just going to put your arm underneath their chin, and we're going to demonstrate how much head movement he has here. So he can move around quite a bit to get at that peanut butter. Good boy, Sam. Okay. But I still have my hand on my arm here, and I'm able, if needed, to increase the restraint. So now say that he's having an exam, and we reach an area that he's paying particular attention to, and he's a little unsure about it, and I feel like I need just a little more control. Keeping my elbow up underneath their mandible and turning out my palm right behind their ear really helps increase that head control. So you can see he can't move nearly as much. All right, buddy, good boy. Good. And then if we have a dog that's really rambunctious and is maybe getting something painful done, maybe he has a hurt leg or something that's getting examined, then we're going to complete that hold, again, keeping our elbow up, palm out, but I'm just going to put the palm of my hand on the back of my head. And you can tell now he doesn't have hardly any movement doing that. So after we're done with that hold, you can slowly release back into this one and then back down to here. So the key is to really keep your elbow up underneath their mandible, and that's going to give you the best control and also make sure that you're not putting any pressure on their soft tissue here. So that's what we call the progressive head hold. Good boy. And that's it. Hope that you enjoy these tips and they help you out. And just remember to always start out with the least restraint, but always keep a hand on them and move up from there if you need to. Thanks.